All right, so over time, I've been doing this thing where I'm seeing patients in their home as a house call nurse practitioner, writing prescriptions for them. And a lot of times, I don't feel as though the patients are benefiting from the service, in the sense that a lot of these patients that we service are on Medicare, government assistance programs. And it turns out that sometimes you write a prescription for these patients and they're supposed to get like 90-day supply of medication. When you talk about 90-day supply of medication, you're talking about, let's say, about 5 different medications they're getting for 90-day supply. You understand? And a lot of these patients cannot afford $10. They cannot afford $10. And it's not necessarily the copay that is the problem, you know. It's the fact that when you go back to see some of these patients and you hear that they didn't get the medication because they never really have the $10, and then to hear that they're not eligible anymore for Medicaid or Medicare, it is just something that is very concerning for me, because in the end, these patients are only suffering. They're only suffering. Their chronic conditions are not being managed properly because they're not able to get the medications. They're not able to do the necessary follow-up that they need with their specialists because they don't have any insurance. They don't have any healthcare insurance. You understand? And so it is very concerning, not only for those patients, but a lot of other persons who are out there. It can be very, very, very difficult for you guys, because as I say, some of these patients, their only copay is $10 and they cannot afford it. And then to hear that they are no longer eligible, which means I'm not going to be able to see them anymore. And so what is going to be the end result for these patients? Their health is going to decline. You're going to have more people dying. You're going to have more people dying because of complications, because they don't have the basic insurance. So it's not until things have gotten worse, these patients are going to get the care. After an admission, it's the same thing they're gone back to, because they're not going to be able to do any follow-up because they don't have the insurance for Medicare and they can't afford the out-of-pocket cost to see a primary care provider for follow-up. And so it's just sad, and it is just so sad, and it is so depressing. Every day I go out and it's almost the same sad story. It is the same sad story out there. It is as though I'm not getting any fulfillment out of what I'm doing. That's how bad it is. When I got into house call service, I wanted to do it because of the fact that I would be able to spend more time with these patients. I would be able to advocate for them a little bit better, get more things going for them. But it feels as though once I leave the hospital and come home, that's the end of it. So a lot of these patients still don't have any prescriptive plan. They don't have any medical plan. They don't have dental, vision. Plus they don't have a job and they don't have any money. So I don't know what is going to happen, a couple months from now. But as far as I'm concerned, it's not working out for them. It's not working out for them. And all of those other persons who are in situations and you're thinking that, oh, when you get to a certain age, it's going to work out for you. It's not going to work out for you. Because I've seen where elderly patients are in the same situation who are just not eligible anymore for certain things. And so it's like the house call service just have to drop the patient. And sometimes I go home and I'm wondering, okay then, 87-year-old, 90-year-old patient who have no family member available to take care of them, they even coping. Because if you don't have Medicaid to help with getting you home health aid, if you don't have the prescriptive plan, it's like you're just gonna be there dying. That's just it. But I will tell you a little bit more in a bit. I'm gonna see a patient, and then from there I will come back and share a few more stories with you. But remember to subscribe and follow on my channel here, where I'll be sharing insight into my daily activities regarding as a nurse practitioner, and just general tips, you understand? So that way we can help out each other on this journey in nursing. Until then, I will see you in the next video. Bye.